Welcome to online vaccination science resources for COVID-19 education. My name is Davida Smith and I'm an Associate Professor of Natural Sciences at Eugene Lang College of Liberal Arts at the New School in New York City. This presentation is the last in a series of 4 presentations aimed at introducing you to the process of science. This particular presentation is focused on the tentative nature of science. Upon completion of this module, students will be able to justify the tentative nature of science, as well as defend the nature of science as an ever-changing, ongoing dynamic process subject to the availability of supporting or refuting evidence. This presentation will cover what we actually mean by tentative. It will also cover why being tentative is a good thing, and we will tackle some misconceptions about the tentative nature of science. How do we define the word tentative? Well, the word tentative comes from the Latin tentare, to attempt, and its original meaning was attempted, provisional, and experimental. It placed the emphasis on trial and error. Today we understand it as meaning not fully worked out or developed, as in a tentative date, a tentative plan, or a tentative job offer. We discussed in previous presentations how the process of science is reliable and durable. But we've also addressed that scientific knowledge is neither set in concrete nor perfect. It is subject to change in the light of new evidence. It's important to note that our knowledge can also change with new interpretations of existing evidence. And as science is tentative, it means that scientists can never know the absolute truth. Owing to the tentative nature of science, theories and laws may in fact change. This is due to the process. Remember, it is ongoing. And as we gather more data and more evidence, our understanding of the natural world increases. Let's review our understanding of the scientific process. Science is above all else a process. It's an ongoing process that has at its core the scientific method. The goal of science is to explain the natural world. The process allows us to learn about the natural world and in so doing understand the natural world. The natural world includes all the components of the physical universe, such as atoms, plants, ecosystems, animals, communities, galaxies, etc. And it also includes the natural forces at work on those things. Supernatural elements that are not of this world cannot be investigated by science. Ideas drawn from observation and data give rise to testable claims or hypotheses, which then give rise to experimentation. Testing involves figuring out what one would expect to observe if an idea were correct, and comparing that expectation to what one actually observes. The product of experimentation is evidence that can be used to either support or help refute a scientific claim or idea. Let's examine some historical cases. Throughout our history, there are countless examples of scientists and forward thinkers who went against the dogma in pursuit of their scientific ideas and hypotheses. John Snow was a marvellous example of someone who single-handedly established an entire field of science through his investigations, the field of epidemiology. In his time, people believed that sickness was due to bad air or miasma. His upbringing, his training in medicine and anesthesiology, as well as his investigative skills and ability to synthesize lines of evidence from multiple sources, allowed him to trace a huge outbreak in London of the waterborne disease cholera to a single source, the Broad Street pump, shown here in this map. His findings were not broadly accepted at the time, but of course now our ability to tackle the COVID-19 pandemic owes much to the evidence collected and the theories generated by John Snow. Our second example is Ignaz Philipp Semmelweis, who was poorly treated by his peers when he suggested that hand washing could reduce infant mortality. He was studying 2 maternity wards at one hospital, one of which was staffed by male doctors and medical students, and the other was staffed by female midwives. When he counted the number of deaths by childbed fever on each ward, he found that the rate of death was 5 times higher for the clinic staffed by doctors and medical students. Semmelweis hypothesized that there were particles, little pieces of corpses, that the students were getting on their hands during the dissection of cadavers. When the students were delivering babies, these particles would somehow get inside the women, who would then go on to develop childbed fever and die. He suggested that everyone should clean their instruments and hands, not just with soap, but also to use a chlorine solution. Death rates fell. This should have been enough to persuade people that hand washing saved lives, but it was not to be. The doctors were upset because his hypothesis made it seem as though they were the ones giving childbed fever to the women. He also lacked tact and publicly berated people who disagreed with him. As a consequence, he made enemies. The doctors soon gave up the chlorine hand-washing protocols, and he lost his job. Today we have campaigns to encourage hand-washing in the time of COVID-19. It remains one of the best ways to reduce infection, all infections in fact. And the need to be effective in communicating health measures remains critically important. Our last example is James McCune Smith. He was an abolitionist leader, and he aided refugee slaves through the Underground Railroad and was the first African American to hold a medical degree, to run a pharmacy in the United States, and to have articles published in American medical journals. He was a trailblazer. In 1837, he graduated from the University of Glasgow and practiced medicine for nearly 20 years. After his studies, he came back to New York City, where he worked with orphans and administered vaccines. Professor McCune Smith helped to discredit popular ideas about differences among the races, which included the study of phrenology, which we've met before. Phrenology, if you recall, was a so-called scientific practice at the time that was applied in a way to draw racist conclusions and attribute negative characteristics to ethnic Africans. His contributions included his 1843 lecture series titled Comparative Anatomy and Physiology of the Races, which helped to demonstrate the failing of phrenology. It wasn't until the 21st century that phrenology was subjected to scientific testing using advanced imaging technology. Now some contemporary cases. When I was a girl, back in the 1980s, almost everyone thought that physiological stress or psychological stress or eating spicy foods caused ulcers. But two Australian scientists discovered that the culprit was in fact a bacterium. Their discovery led to the Nobel Prize in 2005, and we now use antibiotics to cure ulcers. Scientists Warren and Marshall had discovered hardy, corkscrew-shaped bacteria called Helicobacter pylori in the gut by biopsying the tissues of patients who had ulcers and culturing the organisms in their lab. Marshall and Warren believed the cure to be antibiotics. The mainstream gastroenterologists were dismissive of their ideas, believing that ulcers were in fact caused by stress. Marshall tried to make the case with mice, but it didn't work because H. pylori only affects primates. He was prohibited from experimenting on people, so he ran an experiment on the only human patient he could ethically recruit, himself. He took some H. pylori from the gut of a patient, mixed it with broth, and drank it. Over the next few days, he developed gastritis, the precursor to an ulcer, and he started to vomit. He felt sick and exhausted. When back in the lab, he biopsied his own gut, culturing H. pylori and proving his hypothesis that bacteria were the underlying cause of ulcers. In our second example, it took a marvel of technology, the electron microscope, to allow researchers to observe the HIV virus for the first time. This added to the evidence that the virus was responsible for the disease called AIDS. Despite the marvels that have been accomplished in the field of HIV and AIDS, research from treatments and prevention, to this day questions still remain regarding the origins of the virus itself and how the virus jumped into its human host. In our last example, we tackle measles. The prevalence of measles virus in the United States has been increasing. The disease was officially declared eliminated in 2000 in the United States, but data from the Centers for Disease Control and Prevention showed that in 2019 it was at its highest levels in the US since the early 1990s. The problem, according to the CDC and the World Health Organization, is vaccine hesitancy. The reasons for vaccine hesitancy are complex, but by far the study most responsible is the now retracted study of Wakefield et al. That continues to be cited and credited as linking vaccines to autism. Among other concerns with the study, it was found that some of Wakefield's research was funded by lawyers acting for patients who were involved in lawsuits against vaccine manufacturers. Britain's General Medical Council found that Wakefield had acted unethically and had shown callous disregard for the children in his study who were subjected to invasive tests. The study was retracted by The Lancet, and Wakefield lost his medical license. Since then, the link between vaccines and autism has been discredited by a plethora of studies. From 2003 onwards, no link has been found between thimerosal-containing vaccines and autism spectrum disorder, or ASD, as well as no link between the measles, mumps, and rubella vaccine and ASD. What specifically is behind the manifestation of autism remains a question for science. And lastly, let's tackle some present-day cases. Data had been gathered mostly by male scientists studying birds in the northern hemisphere, where male birds sing. As research has expanded to include the study of birds in the southern hemisphere, it has involved greater numbers of female scientists as well as citizen scientists. And as a consequence, we're learning more and more about female birds and their songs, which are far more prevalent than previously recognised. Rather than accepting the dogma that only male birds sing, or that song is rare in female birds, it is becoming clear that this new research is showing that female birdsong is more widespread than previously known. Now, rather than asking why males originally evolved song, the question has become why both sexes originally evolved song, and why females have lost song in some species. One of the defining characteristics of science is that it deals with observing the natural world. It cannot deal with things that cannot be observed. Yet scientists knew of the existence of black holes, but they could never observe one. They had theorized that they could image black holes by capturing their silhouettes against their glowing surroundings. The ability to image an object so far away was beyond them. So they formed a team, creating a network of telescopes known as the Event Horizon Telescope, or EHT, and made use of a technique that allowed for the imaging of faraway objects known as Very Long Baseline Interferometry, or VLBI. And here is the first picture of a black hole that we observed in 2019. Upon its original discovery, Pluto, in 1930, was classified as the 9th planet in the solar system. As a child, I had to learn the order of the planets in school, and it ended with Pluto. But in 2005, astronomers discovered a new object beyond the orbit of Pluto, known as Eris, which was substantially larger than Pluto. Over the next few years, several more large objects were also discovered in the same region, and it's thought that there could be many more of these beyond Neptune. So, the International Astronomical Union voted in 2006 to change the definition of a planet, specifying that the object must be large enough to clear its orbit of other objects and debris. Planet-like objects that do not satisfy this condition were classified as dwarf planets, and thus Pluto became a dwarf planet. Let's pause here for assignment 1.